Hello, I am Professor Govind Narayan Purohit, the former university head, Department of Veterinary Gynecology and Obstetrics, College of Veterinary and Animal Sciences, Bikaner, Rajasthan, India. Friends, I am highly thankful to you if you have already subscribed to my channel. If you have come to the channel if you are visiting the channel for the first time, kindly do not forget to hit the subscribe button and turn on the notifications and press the bell icon so that you receive the notifications of our videos very fast. Friends, we have been discussing the various topics and you can scroll through the playlist and search the video of your interest and see to it. Today we talk about the important metabolic disorder of dairy cattle and buffaloes, the ketosis, or also known as acetonemia or hyperketonemia, and let's understand how it occurs and how we can treat and prevent the disease, right? So let's start. Ketosis is a metabolic disorder that results because of negative energy balance during the early postpartum period of cows, when large amount of fat is utilized as an energy source to support the milk production. The fat is mobilized faster than the liver can metabolize, resulting into ketone production exceeding the ketone utilization by the animal's body, right? Now, the etiology of ketosis is poorly known. Subclinical ketosis is normal in high producing dairy cows, and low feed intake compared to requirements results in hypoglycemia. That results in increased gluconeogenesis in the liver, the glucose from glycerol and amino acids. Interference in this pathway, that is the lack of oxaloacetate, converts ketogenic volatile fatty acids to ketone bodies. Failure of hepatic gluconeogenesis to supply adequate glucose for lactation and body needs may be one cause for ketosis. However, poor feedback control of non-esterified fatty acid release from the adipose tissue is another likely cause of ketosis and the fatty liver. Now, ketosis and fatty liver are two associated diseases which occur in the high producing dairy cows, right? The ketosis occurs because the peak yield occurs at 4 to 6 weeks, but peak dry matter intake occurs at 8 to 10 weeks. So there is a negative energy balance, right? The ketosis has been classified as clinical and subclinical, and it has also been classified as type 1, which occurs 1 to 2 weeks postpartum period and is also known as the fatty liver. And then the type 2, which occurs between 4 to 6 weeks postpartum and is known as the ketosis. It has also been classified as primary ketosis and secondary ketosis, and there are some other classifications also. Ketosis occurs during the early lactation and in high milk yielding animals because of negative energy balance, and sometimes feeding of silage with high butyric acid can lead to incidence of ketosis, right? Now, the low levels of glucose result into mobilization of the adipose tissue and increase in non-esterified fatty acids and beta hydroxybutyrate in the liver, and this leads to ketogenesis and gluconeogenesis. During the transition period, the dry matter is decreased, and so the propionate in rumen is decreased. This leads to fat mobilization and increased non-esterified fatty acids and increased acetyl-CoA. So acetyl-CoA, when it is not utilized properly, it is converted into ketone bodies, and if the non-esterified fatty acids are not mobilized, then they deposit in the liver and result into fatty liver. The normal blood glucose concentration in ruminant species, especially cow, sheep, goat, varies from 42 to 80 milligram per deciliter, and adult ruminants have still lower level than the newborn ruminants, right? Then ketosis types have been classified as primary and secondary. The primary occurs due to the negative energy balance, and secondary occurs because of some other disease. There is a energy deficit because the animal is not able to feed properly. Then ketosis has been labeled in some classifications. It has been labeled as alimentary ketosis because of high feeding of ketogenic feeds containing high butyric acid. Then it can occur because of poor feeding, starvation ketosis, and then because of deficiency of cobalt and phosphorus and low TDN, there can be a deficiency ketosis. Underfeeding will produce a hypoglycemia and ketonemia, but will not necessarily produce the symptoms typical of primary ketosis. The prevalence of ketosis, it is more common in stall-fed, high-producing cows. The peak prevalence is during first 2 to 3 weeks of calving, and low prevalence at first and high at fourth lactation. So that is about the prevalence of the ketosis. Now we try to understand how ketosis actually does occur. In ruminant species, the dry fodder, it goes to the rumen and it leads to formation of acetate and butyrate, the two volatile fatty acids. Whereas the grains or the concentrate, it leads to production of another volatile fatty acid, propionate. The propionate is a precursor to the formation of glucose. It reaches the liver and is the precursor for release of glucose utilizing oxaloacetate and release of energy. The glucose is then utilized in the udder to form the lactose, and glucose and galactose, they form the lactose, which is required as a milk sugar. So when during the early postpartum period, when there is a low feed intake, few weeks postpartum, so there is a low propionate. When there is a low propionate, then there is a low glucose. So when there is a low glucose, the fats are mobilized from the liver and there is a lipolysis. This leads to release of non-esterified fatty acids. The non-esterified fatty acids, they reach the liver, are converted to triglycerides either and deposited in the liver, so that results into fatty liver, or they are otherwise they are converted to glucose by utilizing oxaloacetate. But when oxaloacetate is less, then this is converted into ketone bodies. So there is release of ketone bodies. Ketone bodies mainly are acetone, aceto-acetate and beta-hydroxybutyrate. These ketone bodies enter the circulation and are excreted in the milk, urine, and they sometimes even reach the brain and lead to nervous signs of ketosis. Then because there is a deficit and the fats are mobilized very fast and there is a deficit of glucose, so the milk production is reduced, the feed intake is further reduced, and because of loss of fat, the animal loses the body condition. So there is a wasting. The pathogenesis of bovine ketosis is incompletely understood. However, it requires a combination of intense adipose mobilization and a high glucose demand. Then also some degree of ketonemia may be normal in some dairy cows without any clinical signs. But it's the balance of ketone utilization and ketone production. When the ketone production exceeds the utilization by the animal body, then the clinical signs do appear. And of course, when the ketone bodies, they reach the brain along with a deficit of glucose, there are the nervous signs, right? So we can, in nutshell, we can say that too little glucose, there is mobilization of fat reserves, and hypoglycemia leads to fatty acid catabolism, acetyl-CoA production, and when there is shortage of oxaloacetate, there is ketone production. So this leads to hyperketonemia and clinical signs. And when there are more free fatty acids converted to triglycerides in the liver, they deposit in the liver, and this leads to fatty liver or the type 1 ketosis. Then basically the ketosis has been classified as primary and the secondary. The primary has two forms, the wasting form and the nervous form. The primary ketosis, these are the clinical signs, occurs 4 to 6 weeks post-calving. There is decrease in appetite and milk production. There is selective anorexia for concentrate. So this is the first history given by the owner, that the animal continues to eat the fodder, but it refuses to eat grain. So this is a clue for the clinician to just grasp whether the animal is suffering from ketosis or not. Then the animal has constipation, hard feces, and moderate weight loss. A peculiar finding is the acetone-like smell in the breath, a typical odor in the breath, in the urine, in the milk. So a clinician can just judge whether the animal is having ketosis or not. Going near to the animal, smelling the breath, you will find a typical acetone-like smell. If you have not just smelled acetone, you can do one thing. You can have a bottle of nail polish remover and then smell it. That is the typical acetone-like smell, which can be diagnostic for ketosis in dairy cows and dairy buffaloes. Then in the nervous form, there are nervous signs like walking in circles, head pressing, licking and chewing movements, hyperesthesia, and sometimes even blindness. In the secondary ketosis, the clinical signs are similar to ketosis but less marked. And usually there are other problems like metritis or mastitis or retained placenta, something of that sort, and it appears earlier 1 to 2 weeks of calving, right? So you can see in these pictures, the animal is having wasting. This one is also having a wasting form of ketosis. The nervous form of ketosis, the animal is pressing the wall with his head. And as far as the buffaloes are concerned, metabolic disorders related to parturition have a low incidence in the buffalo. The levels of glucose and calcium are fairly stable during early lactation in buffaloes, and metabolites like glucose, calcium, phospholipids, magnesium, and insulin are higher in buffaloes compared to cattle. So they have a lower incidence. Maybe buffaloes have a higher incidence of this hypophosphatemia, but they have a lower incidence of both hypocalcemia. It's really very low, and then ketosis. Some buffaloes may have ketosis. What are the effects of ketosis? The ketosis will result into fat mobilization. There is a weight loss. There is hypoglycemia. So there is low milk production. Then there is ketonemia. It leads to altered neutrophils and immunosuppression. So there is other disease. Ketonemia plus hypoglycemia affects the brain and also the rumen microflora, they change. And there is production of isopropyl alcohol in the rumen, which also can reach the brain and lead to the nervous signs. There is decreased feed intake, and then there can occur other diseases also. Right? The diagnosis of ketosis, as I said earlier, you can just have a bottle of nail polish remover and smell it, and you can be very sure this is the smell of acetone, which you will find in cows. You just enter a farm and you will find if a few cows or 1 or 2 are having ketosis, you will just be able to make this through the typical acetone-like smell. Then the diagnosis can be on the basis of history of recent parturition and lactation status and milk yield. Then there are certain cow side tests which predict the ketone bodies in the urine and the milk. And then there are laboratory tests such as detecting the ketone bodies in the blood, urine, milk, and the non-esterified fatty acids or the glucose levels in the blood. So we talk of them. Then CBC will reveal lymphocytosis, neutropenia, and eosinophilia. And then there is ketonemia, hypoglycemia, ketonuria, and ketolactia. These are some of the levels of the ketone bodies in the normal level and levels in ketosis. You can see here aceto-acetic acid 0.1 milligram per deciliter, but in ketosis it's 7 milligram per deciliter, and beta hydroxybutyrate it's increased very high up to 30 milligram in ketosis, and ketone bodies in milk up to 40 milligram per deciliter, and urine 500 to 1000 milligram per deciliter. So you can see that ketone bodies, detecting high ketone bodies is diagnostic that the animal is probably having the ketosis. The hypoglycemia, the glucose levels may go as down as 20 to 30 milligram per deciliter, and then there is ketonemia, ketonuria, elevated non-esterified fatty acids and cholesterol. Now, a simple cow side test is the Rothaus test. The principle of this test is that aceto-acetic acid or acetone reacts with nitroprusside 5% in alkaline medium to form a purple colored complex. You can see here a purple colored complex. So for this, 5 ml of urine, to 5 ml of urine, add 1 gram of ammonium sulfate and 3 drops of sodium nitroprusside 5%. And a purple color ring indicates that the animal is positive for those ketone bodies. And you can just compare with the color chart and know how much ketone bodies are present. Then there is the heart test for beta hydroxybutyric acid. In this test basically involves the conversion of beta hydroxybutyric acid to acetone, which can then be detected by the nitroprusside test. For this, 20 ml of urine is acidified with dilute acetic acid and then boiled until it becomes half of the original volume. This amount is cooled and then raised to original volume with water. The purpose of this process is to remove the aceto-acetic acid and acetone. The specimen is then divided into 2 portions and put into 2 test tubes. Next, 1 ml hydrogen peroxide is added to the first portion, which is warm and cooled. In this process, beta hydroxybutyric acid is changed to acetone. Then 10 drops of nitroprusside solution are added to both tubes and overlaid with ammonia to read the results. It is considered that evaluation of beta hydroxybutyrate is the best test for monitoring the ketosis. Commercially available reagent bottles are available to test for beta hydroxybutyric acid. Then commercial ketodiastrics, which tests the glucose and the aceto-acetate or acetone, and the POTA-BNB, which tests for beta hydroxybutyrate. Then there are other commercial preparations which can test simultaneously the glucose as well as the aceto-acetic acid or acetone are available. The Ketolac BHBA test strip with a cutoff threshold of 200 millimolar of BHBA in milk is potentially useful too. Then differential diagnosis for nervous ketosis, one must rule out rabies and other diseases or those involving the central nervous system. And then for the primary ketosis with a wasting form, traumatic reticuloperitonitis, indigestions like things, abomazar displacements, they should be ruled out. Many a times ketosis is coexistent with a hypocalcemia, and that will complicate your diagnosis. Now we come to the therapy. Restoring glucose and reducing the ketone bodies is the primary goal of therapy. So the glucose precursors like glycerine or propylene glycol 300 ml twice daily for 2 to 3 days orally can help. Basically, they can help in subclinical ketosis. And then sodium propionate 100 to 200 gram, calcium, sodium or ammonium lactate 200 gram given orally can also help. Propylene glycol, what it does, it either escapes from the rumen wall or gastrointestinal tract and is converted to glucose by the liver, or it helps in the production of propionate and thereafter glucose in the liver. Now, oral feeding of glucose is not suggested for the ruminant species because that can lead to formation of lactic acid that will further complicate the problem. But small quantities of jaggery, 100 gram, may be fed. Then, for clinical ketosis, the best therapy is intravenous administration of glucose, 25 to 50% is suggested, 500 ml intravenously. The dextrose suppresses the non-esterified fatty acid release and hepatic ketogenesis for a few hours, which is beneficial for the animal. A rough rule of thumb is 1.6 bottles of 50% glucose per 4.54 liters of milk. Then administration of 500 ml of 25% xylitol can be used to prolong the effect of all carbohydrates and polyalcohols. Xylitol has the most pronounced anti-ketogenic action. Then in refractory cases, sometimes you have to administer 50% dextrose very frequently, maybe daily or maybe every alternate day, depending on the case. And if the animal is not responding, it is suggested to administer 0.5 international unit per kg body weight of insulin, maybe up to 200 international units subcutaneously, along with 50% dextrose in refractory cases. Then how to differentiate a primary and a secondary ketosis? A failure to get a good response to an adequate dose of one of or more of the effective glucocorticoids or glucose is an evidence that one is not dealing with a primary ketosis. Corticosteroids can be useful because they break down proteins to release glucose, and 10 to 20 milligram of dexamethasone increases blood glucose concentration, decreases ketone body concentration by repartitioning glucose and depressing the milk production, which can be beneficial. But be careful with repeated injections of isoflupridone acetate, as clinical hypokalemia may result. So be careful using isoflupridone. Then the therapy can, one can use anabolic steroids, 50 to 100 milligram intramuscular, and then cysteamine, which is a precursor of acetyl-CoA, 750 milligram intravenously, 3 doses at 1 to 3 day interval can be helpful. Monensin sodium, it enhances the propionate production, so it can be fed 25 milligram per day with the feed. Recent studies strongly support the effectiveness of vitamin B12 in improving the energy homeostasis in periparturient dairy cattle. Thus, B complex injection should be given to animals with ketosis. Then a recent study, it also showed the beneficial effects of levocarnitine, 3 to 5 gram intravenous for 3 days. Carnitine is available as 1 milligram per 5 ml injection. Levocarnitine supplementation increases the capacity to oxidize non-esterified fatty acids, which decreases the fat accumulation in the liver. Then administration of antioxidants such as vitamin A, vitamin E, vitamin C are helpful. Then another concept is supplementation of 350 gram of rumen protected glucose. It reduces the serum concentrations of DHBA, NEFA and AST while increase the serum glucose concentration. So that can be tried. Then avoiding complete milking. Milking out 50 to 75% quarters every 12 hours was found better than milking the quarter every 24 hours and can probably do for 5 days without significantly impacting the lactation curve. Force feeding is clinically useful in valuable cattle, but the efficacy is not documented. Prepare a slurry by dissolving alfalfa cubes and pelleted concentrate in warm water and pump the slurry into the rumen using bilge pump and large diameter stomach tube. Type 1 ketosis or the fatty liver results from a state of negative energy balance and is one of the important metabolic diseases of post-parturient dairy cows. But it occurs during the first 2 to 4 weeks of postpartum. Although often considered a postpartum disorder, it usually develops before and during the parturition. Blood tests will reveal elevated non-esterified fatty acids and increased ketones. Without treatment, mortality in fatty liver can be as high as 25%. And besides long-term infusion, intravenous infusion of glucagon, there is no proven treatment for fatty liver. 3.75 milligram of lyophilized bovine glucagon dissolved in 60 ml of 0.5 m sodium chloride can be given subcutaneously. Now, prevention of ketosis, that's very important. High fiber, low energy diet during gestation and gradually increasing the grain ration near the end of the dry period. This is very important. this will prevent the negative impacts of very fatty cows, or it will also help to minimize the negative energy balance during the postpartum period. And then high energy diets during the postpartum period. And after calving, the animal must be provided an adequate amount of energy rich concentrate, 16 to 18% protein feed according to the milk yield. Sudden change of feed should be avoided. Daily use of sodium propionate, 200 gram for each cow after calving, can be helpful. Then prevent overcrowding of the transition cow facilities. Don't mingle cows with heifers. Reduce the number of pen movements. Monitor body condition score in late lactating cows. And then daily exercise. That's very important. Prevent overconditioning and starving both. Then feeding of commercial gluconeogenic precursors. Many are available, and then dosage could be 100 to 200 ml daily. Feeding bypass fat at the rate of 15 to 20 gram per kg milk yield to prevent negative energy balance could be one option. Then sodium bicarbonate may be incorporated in feed to prevent development of acidosis due to excessive concentrate feeding. Then probiotics, vitamin and mineral supplements should be included in the feed during the peak lactation period in order to improve the feed utilization and the metabolism, right? For herd problems, regularly check for ketonuria during the 2nd to 6 weeks of lactation. Reduce the silage and urea component of ration if practical. Disease conditions like retention of placenta, metritis, mastitis, environmental stress should be treated immediately so that they do not precipitate ketosis. Regular weekly testing of urine and milk samples up to 2 months after calving can help in early detection of ketosis, and immediate treatment should be given to save the animal. So these are the body condition scores shown over here, and this is body condition 1, 2 and 3. So a cow must be from 3 to 3.5. So between this one, this is 4 and this is 5. So it must be between 3 to 3.5. That is the optimal body condition score at calving. If the body condition score is low, there will be low milk yield and any stress. And if the body condition is more than 3.5, then there will be milk fever, ketosis like this, right? So you can contact me at my email gnpobs@gmail.com, and this is my YouTube channel link. You can just scroll through the playlist and view the video of your choice. Kindly do not forget to hit the subscribe button and press the bell icon, and kindly do give your likes, give your comments, give your suggestions, and share and subscribe the video to others, and also subscribe to my channel Govind Narayan Purohit. So hopefully this information was good, and if you subscribe to my channel, I will be enthused to bring in more and more videos for you. So thank you. Bye bye.